When we think of a nurse, we often picture someone in scrubs, maybe administering medication or checking a vital signs monitor. While these actions are certainly part of the job, they represent only a fraction of what it truly means to be a nurse. Nursing is not merely a collection of tasks to be completed. It is a profound professional practice built upon a deep and multifaceted foundation of knowledge. This knowledge transforms clinical actions into a holistic, healing experience. It is the invisible architecture that supports every decision, every interaction, every moment of care, ensuring patients are treated not as a set of symptoms, but as whole human beings with unique needs, fears, and hopes. The first and most recognized pillar of nursing knowledge is empirics, the science of nursing. This domain is rooted in facts, data, objective reality. Empirics relies on information that can be observed, tested, verified. It includes anatomy, physiology, pharmacology, pathophysiology. Knowing how a medication affects kidney function or spotting physiological changes that signal deterioration is empirical knowledge in action. A cornerstone is evidence-based practice, EBP. EBP integrates research, evidence, clinical expertise, and the patient's values and preferences. It moves away from tradition toward rigorous, accountable care. For example, instead of an outdated wound technique, the nurse consults current research, chooses the best dressing, promotes healing, and prevents infection. Science shows up in every task: precise dosing, reading monitors, interpreting labs. If empirics is the science of nursing, then aesthetics is its art. It moves into the subjective, nuanced realm of human experience. The art is perception, empathy, context, seeing the whole picture. It reads unspoken cues, behavior, tone, body language. Aesthetics is expressed through empathy and compassion. A gentle touch, listening without judgment, a blanket for someone cold and scared. These aren't in a care plan, but they're profoundly therapeutic. A nurse may sense postpartum depression and open a gentle conversation. Presence, listening, and connection transform fear into trust. This intuitive artistry deepens with experience. The third pillar, personal knowledge, is the most introspective. It's understanding one's values, beliefs, biases, and emotions, and how this inner landscape shapes practice. It's cultivated through experience, self-awareness, and critical reflection. After difficult events, reflective nurses ask, what went well? What could I have done differently? How did I feel, and did it affect my actions? Reflection turns raw experience into practical wisdom for future situations. Personal knowledge includes therapeutic use of self, sharing appropriately to foster empathy while keeping the focus on the patient. It requires restraint, authenticity, and presence. Nurses who cultivate this are more resilient, empathetic, and ready for the profession's emotional demands. Ultimately, bringing one's whole self with ongoing growth elevates care. The fourth pillar is ethics, the moral compass of nursing. It asks what is right and wrong in patient care. Core principles: beneficence, do good, non-maleficence, avoid harm, autonomy, respect decisions, justice, fairness in care. Consider a terminal patient refusing life-sustaining treatment while family insists otherwise. The nurse must uphold autonomy and support the family with compassion. Ethical codes formalize commitments, primary duty to the patient, privacy, confidentiality, and safe environments. Pressure can come from colleagues, administrators, and policies. Ethics keeps nursing trustworthy and humanistic. It prevents care from becoming purely technical. At the center, dignity, respect, and moral consideration, protecting patients and the profession's integrity. Beyond the pillars, nurses rely on practical skills. Mathematics is non-negotiable. Conversions, IV rates, and precise dosing. Small errors can be devastating. Accuracy protects patients. Observation goes beyond monitors. Skin color, breathing pattern, consciousness, demeanor. Notice a slight droop, possible stroke. Hear a faint wheeze, worsening asthma. Early action prevents complications. With patients, explain simply and listen actively. With clinicians, use SPAR, situation, background, assessment, recommendation. Good communication unites the pillars. Poor communication fragments care. Modern healthcare demands teamwork. Nurses coordinate physicians, therapists, pharmacists, social workers, and assistive personnel. They serve as conductors, ensuring unified plans, high-stakes decisions, triage in emergencies, integrate data, intuition, and experience to act in moments. This calm competence is built on all four pillars. Nurses collaborate and also exercise autonomous judgment, leading, following, communicating, listening, and acting decisively when seconds count. Trust in colleagues and one's professional judgment is learned and refined at the bedside, shift after shift. Development is a journey. Skill acquisition progresses through 5 stages: novice, advanced beginner, competent, proficient, expert. Novices follow rules and context-free facts. They need clear instructions and struggle to prioritize. Advanced beginners recognize recurring components but need guidance. Competent nurses set long-range goals and organize care efficiently. Proficient nurses see wholes, anticipate, and focus on what matters most. Experts rely on intuitive grasp to act fluidly and precisely. Mentorship and experience move practice from rigid rule following to fluid, intuitive mastery. Each stage changes how nurses think, perceive, and respond, elevating patient outcomes. In conclusion, making a great nurse is like weaving an intricate tapestry, different but essential threads, the science of empirics, the art of aesthetics, the insight of personal knowledge, and the moral compass of ethics. No pillar stands alone. Integration creates holistic, effective, compassionate care, grounded in science, guided by ethics, delivered with artful compassion for body, mind, and spirit. Experience, reflection, and lifelong learning elevate practice. This is the heartbeat of nursing, healing the person, not just treating disease.